Hi everyone, I'm Dr. David Mercer. Right now, while you are listening to this, there is a good chance something has already been happening inside your mouth, throat, and airway, night after night without you giving it the attention it deserves. Every single morning you wake up with that dry, sticky feeling, your body may be sending a signal that is quieter than pain, quieter than panic, and for that reason far easier to ignore. The frightening part is not what you feel, it is what you do not feel while you are asleep. You do not feel saliva thinning out when it should be protecting your teeth. You do not feel your tongue drying against the roof of your mouth. You do not feel the tissues in your throat losing moisture as air moves in the wrong way for hour after hour. And if this has started happening after 60, the message can matter even more. The good news is that you are hearing this now, not 6 months from now, not after damage has had more time to build, but now, while there is still time to interrupt what may already be in motion. By the end of this video, you will understand what waking up with dry mouth every night can really mean, what your body may be trying to tell you, and what to do before this progresses into something much harder to reverse. And once last night began, the clock may have started much earlier than you think. Maybe it was after dinner when you had something salty, maybe a glass of wine, maybe your evening medications, maybe a cup of tea you thought was harmless. And then hours later, sometime after midnight, your body entered a stretch of sleep where saliva naturally slowed down, as it always does, but not enough to protect you the way it should. Picture your salivary glands for a moment, those small, quiet structures around your jaw and under your tongue, not as background players, but as active night shift workers. In a healthy pattern, they keep a thin, protective film moving across your mouth. They help wash away food particles. They help control acids. They help make swallowing easier, even in sleep. But if you go to bed slightly dehydrated, if your nose is blocked, if your mouth falls open, if certain medications have already reduced saliva production, those steady little workers can slow from a stream to a drip. Then the environment changes. The mouth becomes warmer, stickier, less protected. Your tongue can begin to feel rough by morning. Your lips may crack. Your throat may wake up scratchy. And because this is happening during sleep, many people dismiss it as nothing more than, I guess I just need water. But night after night, that explanation can miss the bigger picture. Think about 2 o'clock in the morning. The bedroom is dark. Everything looks still. But inside your mouth, the chemistry is not still at all. Saliva is supposed to buffer acids and help protect the teeth and gums. Without enough of it, the surfaces of your mouth are more exposed. Bacteria are not taking the night off. They are feeding on what is left behind, especially if there was sugar, starch, alcohol, or even just reduced oral flow. Your teeth are sitting there without the same level of rinse and repair. Your gums are sitting there more vulnerable. That is why persistent dry mouth is not just annoying. It can raise the risk of tooth decay, cavities, bad breath, mouth infections, and trouble chewing or swallowing. And after 60, this matters fast because many adults are already dealing with medications for blood pressure, mood, allergies, sleep, or bladder issues, and several of those can quietly dry the mouth even more. Now add one more layer. If the dryness is strongest in the morning, especially if it comes with snoring, a sore throat, headaches, restless sleep, or waking to urinate often, your mouth may not be the only thing involved. Sometimes the real problem is not starting in the mouth at all. Sometimes it is starting in the airway. Sometimes it is the nose. Sometimes it is the way you are breathing all night long. And that is where this stops being just a comfort issue and starts becoming a warning sign. Because what comes next is the part most people never connect until much later. And the longer this continues, the more serious the picture can become. Because waking up with dry mouth every night is sometimes less like a single symptom and more like a flashlight passing over a whole row of possibilities. At first it may seem minor. A sip of water fixes it. You move on. But the body keeps score, especially when the same pattern repeats in the same hours again and again. Picture yourself at 3:17 in the morning. Your mouth is open because your nose is congested or your airway is narrowing. The back of your throat is drying. Your tongue is no longer resting in a moist environment. The saliva that should be coating the tissues has thinned out. If you are snoring, that airflow can make the dryness worse. If your breathing is interrupted in sleep, your brain may briefly jolt you just enough to reopen the airway, and you may never remember it in the morning except for one clue: that dry mouth, that sore throat, that heavy, unrefreshed feeling. This is why I want to be precise here. Not every person with dry mouth has sleep apnea. Not every dry mouth signal means something dangerous is hiding. But repeated nighttime dry mouth should never be brushed aside if it comes with other clues: loud snoring, morning headaches, waking up gasping, daytime sleepiness, trouble concentrating, mood changes, high blood pressure that has been hard to control, frequent nighttime urination. Those pieces matter because together they can point toward a breathing problem that is affecting the entire body, not just the mouth. And when breathing is disrupted over and over during sleep, oxygen levels can drop, sleep quality can fracture, and the strain can extend far beyond the bedroom. The heart feels it, blood pressure feels it, energy feels it, memory feels it. The next day is not just a tired day, it becomes part of a repeating loop. Now think about another path this could be taking. Maybe you are not snoring much at all, but you are thirsty more often. Your mouth feels dry during the day too, and you are up at night using the bathroom. That can matter because dry mouth is also seen with dehydration and can show up with high blood sugar. In that situation, the mouth is not merely dry because air passed through it. The whole fluid balance of the body may be shifting. Or perhaps the cause is simpler, but still important. An evening medication change, an antihistamine, a decongestant, an antidepressant, a bladder medicine, a blood pressure medicine, something that seemed completely unrelated to your mouth. Yet inside the body, that medication may be reducing the signals or fluid support that help saliva do its job. Then there is the oral health path. Night after night of low saliva can turn the mouth into a place where the teeth, gums, and soft tissues lose one of their most reliable defenses. That means cavities can advance faster. Dentures may become more uncomfortable. A burning sensation may show up. Swallowing can become harder. Food may taste different. The mouth can feel rough, sticky, or strangely tired. It is not dramatic, it is gradual. And gradual is exactly why so many people let it keep going. But this is not the most important layer yet. The next section is where the hidden mechanism finally comes into focus. What happens next, if nothing changes, makes more sense when you understand what saliva is actually doing for you while you sleep. Most people think of saliva as just moisture. It is much more than that. Picture it as a protective night coating spread across your mouth like a living shield. It helps break down food residue. It helps neutralize acids. It carries minerals that support the surface of the teeth. It helps control microbes. It keeps the tongue, cheeks, gums, and throat moving more comfortably. In other words, it is not decoration, it is defense. And around bedtime, when your body is already reducing saliva naturally, anything that pushes production lower can tip you into trouble faster than you realize. Imagine the sequence. You eat dinner at 7. You take pills at 9. You lie down at 10:30. Your nose is a little blocked, so your mouth opens. By 1 in the morning, the mouth is already dried more than it should. By 3, the tissues are tacky. By 5, the teeth have gone hours without their normal protective rinse. By 6:30, you wake up and all you feel is thirst. But underneath that one sensation, several systems may have been interacting the whole night. The nervous system helps regulate saliva production. Certain medicines can interfere with that. Dehydration lowers the available fluid. Mouth breathing speeds evaporation. Poor nasal airflow forces the mouth to do a job it was never meant to do all night long. If blood sugar is running high, fluid balance may shift in ways that make dryness worse. If reflux is present, irritation can compound the problem. And if the airway narrows repeatedly during sleep, the whole pattern intensifies. This is why "I just sleep with my mouth open" is not a complete explanation. It may be true, but the next question is why? Why is the nose not carrying the airflow? Why are the tissues so dry by morning? Why did this become frequent after 60? Why now? The body usually has reasons, and those reasons are often more fixable than people fear when they are caught early. A medication can be reviewed. Nasal obstruction can be addressed. Oral dryness can be treated. A sleep disorder can be identified. Hydration habits can be corrected. But none of that happens if the signal is minimized. Picture your mouth at dawn as the dashboard light, not the engine itself. The dry feeling is the light coming on. The cause may be local, like reduced saliva or mouth breathing. It may be systemic, like medication effects or blood sugar problems. It may be sleep-related, like airway obstruction. But the body is not doing this randomly. It is communicating. And the most dangerous thing is not the dryness itself. It is how easily the message can be postponed for another week, another month, another year. The turning point begins when you stop calling this normal and start reading it as information. Because once you do that, the window for the easiest intervention opens. And at this stage, this is where change becomes possible, because the moment you stop treating nighttime dry mouth like a harmless nuisance, you can start sorting out what category you are actually in. I want you to think about tonight and tomorrow morning like a small investigation. Before bed, notice what you drink, what time you stop drinking, what medications you take, whether your nose feels clear, whether you had alcohol, whether dinner was especially salty, and whether you tend to fall asleep on your back. Then in the morning, do not just notice that your mouth feels dry. Notice the pattern around it. Is your throat sore? Do you have a headache? Do you feel rested or strangely drained? Are your lips cracked? Is your tongue rough? Do you need water immediately? Are you also getting dry mouth during the day or only overnight? That distinction matters. Picture yourself standing in the bathroom just after waking, looking in the mirror while your body is still telling the truth. That first minute of the morning is often more revealing than the whole rest of the day. If you see dryness, smell stronger breath, feel thick saliva, or notice a sticky coating in the mouth, that is useful information. If a bed partner has mentioned snoring, pauses in breathing, choking, or restless sleep, that matters even more. If you have recently started a new prescription or increased a dose, the timing matters. If thirst has increased along with nighttime urination, that matters. You do not need to diagnose yourself. You do need to stop ignoring the pattern. This is also the point where people often make the mistake of choosing relief over understanding. They keep a glass of water by the bed, take a sip, and tell themselves the problem is handled. Relief is fine. Relief is not the same as explanation. If the dryness is occasional, after travel, after a cold, after a very salty meal, after one poor night of sleep, that is one thing. But if it is happening every night, the body is not describing a random event anymore. It is describing a routine, and routines inside the body are where causes live. The encouraging part is that this is often exactly the stage when meaningful improvement can begin. Before deep dental damage develops, before sleep problems go years unrecognized, before an avoidable medication side effect keeps getting worse, before fatigue becomes your new normal. The earlier this changes, the better the body tends to respond. Saliva flow can improve when triggers are reduced. Mouth tissues can recover. Sleep quality can improve. The body is remarkably capable of recovery when you stop asking it to fight the same battle every night. So here is the turning point in plain language. If you wake up with dry mouth every night, do not merely ask, "How do I make this less annoying?" Ask, "Why is my mouth unprotected every night in the first place?" That one question changes everything. And once that question is on the table, the first moves become clear. Here is what changes when you start making the right moves, and how quickly the body can begin to respond. Start with tonight, not someday. Begin earlier in the evening because what you do at 6 p.m., 8 p.m., and 10 p.m. often decides what your mouth feels like at 4 a.m. Hydrate consistently during the day so you are not trying to rescue yourself with a huge glass of water right before bed. That late flood may send you to the bathroom more often without truly correcting the pattern that built up over the entire day. Picture your body as a system of reservoirs, not a dry sponge that can be fixed in one gulp. Gentle, steady hydration works better than last-minute panic drinking. Now think about your evening inputs. If caffeine is still showing up late in the day, pull it back. If alcohol has become a regular nighttime habit, especially close to bed, take that seriously because it can dry the mouth and worsen the conditions that make sleep less restorative. If your bedroom air is very dry, a humidifier can make a real difference by reducing the moisture loss that builds while you sleep. Picture your throat and mouth not fighting dry air all night but resting in a more forgiving environment. If nasal passages are blocked, that needs attention, because the nose is designed to condition the air in a way the mouth simply is not. Mouth breathing may feel automatic, but it often begins with an airway problem upstream. Then move to oral support. Use an alcohol-free mouth rinse made for dry mouth if your dentist or clinician recommends it. Ask about saliva substitutes if the problem is persistent. Earlier in the evening, sugar-free gum or sugar-free lozenges can help stimulate saliva while you are awake. Keep good brushing and flossing habits especially consistent, because if the night is becoming less protective, your daytime care must become more intentional. Picture the enamel of your teeth as a surface that benefits from every hour you make conditions friendlier. Small changes are not small inside the mouth. They are cumulative. And there is one more immediate step that matters more than people expect. Start documenting the pattern. Write down when the dryness happens, whether it wakes you, whether you snore, whether morning headaches are involved, whether medications changed, whether thirst is increasing, whether you are breathing through your mouth because of congestion. That little record can turn a vague complaint into a clear conversation when you speak with a doctor, dentist, sleep specialist, or pharmacist. They do not need drama, they need details. Because if the cause is medication-related, adjustments may be possible. If the cause is oral dryness alone, targeted treatments may help. If the cause is airway-related, identifying it early can change much more than your mouth. The goal is not to frighten you. The goal is to interrupt the process while there is still time and while the easiest corrections are still available. And the next step after these first moves is where protection becomes stronger and more lasting. And over the next days and weeks, the decisive moves are the ones that protect you long-term. Because temporary relief is good, but a repeated nightly signal deserves a real answer. If you are over 60 and this is happening often, make a medication review part of the plan. Not by stopping anything on your own, but by asking your doctor or pharmacist to look specifically at dry mouth risk. Too many people accept this as the price of treatment when sometimes timing changes, substitutions, or supportive strategies can reduce the burden. Picture that for a second. The problem may not be your body failing you. It may be your body reacting predictably to something it needs help balancing. Then think beyond the medicine cabinet. If there is snoring, gasping, choking, morning headache, heavy fatigue, or a partner who has noticed breathing pauses, ask for a sleep evaluation. That is not overreacting. That is acting before a pattern deepens. If there are more cavities, gum irritation, denture discomfort, changes in taste, or a burning mouth feeling, bring your dentist into the conversation. Dry mouth is not only a medical issue, it is an oral health issue, and dentists often see the evidence before anyone else does. If thirst, increased urination, or dry mouth during the day are joining the picture, speak with your clinician about the broader causes that may need attention. The right test at the right time can save months or years of guessing. Now picture what happens when the cause starts getting addressed. Air moves through the nose more easily. The mouth stays closed more often. Saliva has a chance to protect again. The tongue no longer wakes up stuck and dry. The throat stops feeling scraped every morning. Teeth spend less time exposed. Sleep becomes less fragmented. Energy improves. Not overnight in every case, but often sooner than people expect once the right lever is pulled. Research and clinical experience both support something important here. Even small shifts can create measurable results when they target the real cause. And if you are watching this and you recognize this habit, if this feels like it was written specifically for your situation, type the word "today" in the comments. Because that word means something. It means you are done treating a nightly warning like background noise. It means you are ready to pay attention now, while there is still time. Not next season, not after the next dental problem, not after another year of poor sleep. Today. Do the steady things. Protect your mouth. Support your airway. Review the medications. Watch the timing of alcohol and caffeine. Improve the bedroom air. Keep the nose as open as possible. Ask better questions in the clinic. And most of all, do not let repetition trick you into thinking something is harmless. The body whispers before it screams. Nighttime dry mouth can be one of those whispers. But once you hear it clearly, you are in a position to change the ending. And that is exactly where we arrive now. You now know something that many people spend years brushing off, and that changes the tone of this completely. The alarm does not need to keep blaring once you understand what it was trying to tell you. Waking up with dry mouth every night is not a verdict. It is not your body turning against you. It is information. It is a signal. And signals are useful when we respond to them early. Your body has been adapting, compensating, trying to get through each night the best way it can. That matters. It means your body is not the enemy in this story. It has been waiting for support, waiting for attention, waiting for you to notice the pattern and act before it had to push harder. So take a breath and let the urgency become clarity. If this has been happening to you, tonight can be different because tonight you know what to look for. You know to notice the pattern, not just the discomfort. You know to protect your mouth, your airway, and your sleep. You know to bring the right details to your doctor, dentist, or pharmacist. You know there may be a cause beneath the surface, and you know there is still time to find it. That is a powerful place to stand. I want you to live fully. Not just get through your 60s and 70s, but actually feel well inside them. I want you waking up with a clearer mouth, a clearer head, and a stronger sense that your health is something you can influence. Even now, especially now. I'm Dr. David Mercer, and I want this message to reach you before the pattern gets any deeper. Pass this along to someone who may need to hear it today. And stay close, because what we cover next may protect far more than a single symptom. Sometimes one small clue in the morning is the beginning of a much better future at night. If you are over 60, this is a conversation you need to have before another small symptom gets ignored. In this video, Dr. Thomas Ellison breaks down what waking up with dry mouth every night can really mean after 60. From mouth breathing and medications to sleep apnea warning signs and oral health risks. You will learn what may be happening while you sleep, what clues to watch for in the morning, and what steps can help protect your mouth, airway, and energy. If this has been happening to you lately, this video could be the nudge that helps you act in time and feel more confident about your health again.